the Batten School of Leadership and Public Policy. I'm your host for this event. Both presidents are here because we'd like to exchange views with our elected representative in Congress. The gentleman who holds the seat first contested by James Madison and James Monroe. The Batten School has held dozens of discussions with elected officials and policymakers, none of them subject to disruption or allegations of partisan imbalance. The list of guests with whom Batten students have interacted includes Governor Robert McDonald, Terry McCall, Senators Jim Webb, Mark Warner, and Tim Kaine. Previous Republican and Democratic representatives of this seat, Robert Hurt and Tom Garrett. Other representatives, Robert Scott, Jerry Connolly, Tom Davis, and Eric Cantor. Our Batten students have engaged on grounds with presidential candidates Sanders, Kasich, and O'Malley, former Supreme Court Justice Sandra Day O'Connor, top intelligence, defense, and NGO officials. Yesterday, in our school, we hosted gubernatorial candidate Tom Garrett. Today, we host Congressman Garrett. Tomorrow, we will host Senator Evan Bayh of Indiana. Monday, we will host political commentator Bill Kristol. This is what we do at the Batten School. As public servants of this public university, we challenge assumptions. We listen to others' views, especially to those with which we disagree. And then, we search for common ground, not necessarily finding it, but we don't stop looking for it. Each of our previous guests has had a chance to communicate their thoughts and to listen to our students and community members. As dean of this school, carrying on Frank Batten's legacy, I remain deeply and personally committed to the principles of academic freedom and civil discourse. We've made every possible effort tonight to ensure the fairness of these exchanges, so central to our democracy. I will personally vigorously oppose any efforts to deny you, our community members, these rights. When we began a conversation with Congressman Garrett about this community forum, each of us here at the University of Virginia viewed this as both an academic opportunity and, in part, a public responsibility. But first and foremost, this room, this hall, is our classroom. This is, in fact, the Batten School's largest classroom, so please respect it as such. Our students are preparing to lead and shape our Commonwealth and nation. Let us lead by example tonight. This audience has been selected through a random lottery of 5th District residents who have been provided 180 seats. The remaining 50 seats have gone to Batten School students selected also through a random selection lottery. Access to this forum has been limited only by the fire marshal of Charlottesville, who has capped this, our school's largest room, at 230. I believe there's a sign on the door verifying that. You can check on your way out. Let me state for the record the ground rules we agreed to in an effort to advance the public interest in this conversation. As the moderator of this conversation between the congressman and you, the audience, I invite questions from all of you. I hope in your question you will have submitted your name, where you hail from, and your question on the papers provided. In order to ensure we cover as much ground as possible, your questions will be selected by my Batten staff. Before reading your questions, I'll identify the person whose question I will read, and I'll ask you to stand to be able to hear the congressman's response, and then you will have an opportunity to follow up or to respond to the congressman's remarks. Please wait for a microphone. Everybody thinks they have a big voice, but this is a big room. I'll ensure that you have a chance to follow up directly, when necessary, to make sure that your question has been addressed. What I ask and expect of you, my fellow community members, is simply what my mother would call good manners. When I was about 8 or 9 years old, I got in trouble in school, mouthing off one of my teachers. On the way home, my mother said to me, "You can say anything to anyone, as long as you say it politely. Please refrain from shouting, cheering, or booing. This is our largest classroom, as I said. Please treat it as such. We have not in the past, nor will I this evening, tolerate actions that violate the rights of others to hear and to be heard. Questioners giving long speeches at a certain point deny others the right to pose a question. At such point, I will prompt you to yield the floor. Please do so, or you will be asked to leave. Out of respect to you, I'll say the same to our guest if one of his responses drifts into what I deem to be filibuster territory. Yes, it does. Now, let's begin with a nonpartisan welcome to the winner of last November's election to represent us in the House of Representatives, a neighbor from our community, Congressman Tom Garrett. Congressman, do you wish to say a few words before I begin with the Inquisition and questions and answers?
The Inquisition? No, yeah, just we'll start off by thanking...
Hey, hey! Ho, ho! White supremacy got to go! Hey, hey! Ho, ho! White supremacy got to go! Hey, hey! Ho, ho! White supremacy got to go! Hey, hey! Ho, ho! White supremacy got to go! Hey, hey! Ho, ho! White supremacy got to go! Hey, hey! Ho, ho! White supremacy got to go! Hey, hey! Ho, ho! White supremacy got to go! Hey, hey! Ho, ho! White supremacy's got to go! Hey, hey! Ho, ho! White supremacy's got to go! Hey, hey! Ho, ho! White supremacy's got to go! Hey, hey! Ho, ho! White supremacy's got to go!
Congressman Garrett, as you're saying.
And it's raining here like the snow. The Batten School for having us here, and President Sullivan of the University of Virginia for exercising leadership from across two continents. It's just an amazing opportunity to be here at Mr. Jefferson's University and have the opportunity to exchange ideas and to know that we won't agree on all of them. We were talking about this in the green room before this, and we've heard some chants outside that now you've all heard. Hey, hey, ho, ho, white supremacy got to go. And my chief of staff said we were chanting, we agree. And so I think it's appropriate to extend a round of applause first to the Batten School and President Sullivan for making this happen. So I invite you to do that. And then to quote the founder of this institution who wrote, "We hold these truths to be self-evident that all men are created equal and endowed by their Creator with certain inalienable rights, that among these are life, liberty, and the pursuit of happiness." Folks, there's no place for white supremacy in the forum of Thomas Jefferson University or the nation of the United States of America. And so I'd ask for a bipartisan round of applause. Yes. Again, it's a humble and sincere thanks. It's an amazing honor, and I'm just trying to do the best I can to do what I said I was going to do what else tonight.
Thanks, Congressman. So I'm going to exercise my moderator's prerogative here and start off with a question that I think is on a lot of people's minds. There are a lot of passionate people outside this building. There are roughly 850 or so folks that signed up for the lottery for the limited number of seats in this room. Many of those would be outside and prefer to be inside with us than standing in the ring. Why the preference for a relatively small venue for this event?
Unfortunately, as we've seen on the news across the last few months, there's the potential for circumstances to go beyond the control of folks with the best intentions, professionals, individuals who help to ensure a free exchange of ideas. I will tell you that I've never accomplished anything meaningful in my life alone, and that a lot of the people who helped me to have the opportunity to serve in the capacity of the Congressman from the 5th District of Virginia might be, for example, 73 years old and have had both knees replaced. Might be, for example, the recipient within the last week or two of an MRI or medical procedures that mean that they're more vulnerable than perhaps other members of the population. And it was very important to me to ensure that the people who I love who helped me to get in this position to have this opportunity to serve could also come to this forum, and could also exchange ideas. It's been a real inspiring, I think, success to be sitting here now. And I hope that we can engage in these sorts of dialogues in larger and larger venues. I'm really excited, and I'm going to give a hat tip to Joe Thomas and WCHB to have a radio town hall starting on April 13th from 7 p.m. to 9 p.m. And we hope to do that every month or so for the duration of the time that we're given the honor to serve the 5th District. But I'd love to have a larger venue. I also wanted to know that the people that I love, the people that have been there for me, could be at this venue, and they could do so without fearing for their physical well-being and safety. And so with that, we err on the side, I think, of caution. But I would enjoy the opportunity to do this in a larger venue should we prove that we can execute it here tonight at Batten School in this limited scale.
Well, fair enough, and we'll hold you to that pledge and do another event in a much larger setting. I'm going to take your cue. You mentioned healthcare there. Allison Chavez, a Batten School student, are you here? I think I'm going to reassign your last name. Thank you very much. So this is a healthcare question. There's thousands of people in your district who are working that they cannot afford health insurance. Many worry about lifetime benefits. What are you doing to deal with these sorts of situations?
So the paradigm that we've gotten foisted upon us as it relates to moving forward to address problems with the Affordable Care Act, and there certainly are, is that we need to ensure that all Americans have coverage, or that all people who choose to avail themselves have coverage. The problem is that there's a massive disconnect between coverage and care. And so what we've seen in the last 7 years is premiums skyrocketing, deductibles skyrocketing. I was speaking with the others of the logging operation on Brunswick County yesterday who described health savings plans that they had, that their employees had, where originally their deductible, I believe they said $750. So you get $750 in a monthly payment, it's $250 in premium, or the monthly payment is $75 in premium, and then they were now $250 a month for premium at a $6,000 deductible. What that illustrates is that you can have coverage, but if you don't have $6,000 for deductible, you don't have care. So the most important thing to do now is to create a paradigm where we turn the cost curve down. That's one of the reasons that we've gotten crosswise with the president, that we looked at as related to the AHCA was a plan that didn't do anything to turn the cost curve down and to reduce the rise in premiums for the next 2 years. And while that, according to the Congressional Budget Office, moving forward after that, it would have been too little too late in the nation where 2/3 of people, according to a recent news story, couldn't find $2,000 if they had an emergency. So I want you to think about the difference between care, which is where you get the help you need from a medical professional when you need it, and coverage, which is when you have a piece of paper that says, I have health insurance that does you absolutely no good if your deductible is so high that you can't pay for it. Some of the things that we've done that I'm very proud of include passing the Karen Ferguson antitrust exemption for healthcare. We championed that. That was an editorial that was featured in the Hill newspaper in Washington, D.C., I think 23 days after we were sworn in. We're proud of that. That ultimately passed out of committee, out of the full House, and was gone to the Senate. And I will tell you that our championship of the Karen Ferguson appeal was something that was completely nonpartisan. I'm not sure whether it was yourself, you, or Professor Warburg that discussed this with, but that was an idea originally championed, ironically, by your speaker yesterday, Tom Garrett, and Betsy Markey in 2010. That was pushed through, candidly, through my members of the Freedom Caucus in 2017. And so that proves that nobody has a monopoly on good ideas, that there are things that we can't even have that cost curve down. Another bill that we've passed is the right of associations to unify, to purchase in numbers to create discounts in health care. That bill's left the House and sent it to the Senate. That will help drive down the cost curve.
Well, Congressman Garrett, let me follow up on part of one of the provisions of the AHCA. Before that, Allison, do you have a follow-up? All right, we'll move forward then. Susan Prokop in Nelson County. Are you with us? Thank you. Susan's got a question about provisions of the AHCA. Here we go. In rejecting the AHCA, the Freedom Caucus insisted on stripping patient protections and essential benefits from the bill. I'm a cancer survivor and a small business owner who needs these protections. Do you support these Freedom Caucus provisions? If yes, will you now reject those positions and work for a bipartisan health bill serving all people in your district?
So essential health benefits are things that the Affordable Care Act placed in Title I of the code that regulates healthcare. It says what things must be covered by all health plans. And so if you repeal the essential benefits from the code, then you allow yourself to purchase from a plan that suits your individual needs. So essentially, if you have a need to have coverage for items or procedures that are common for a demographic in which you fit, then you can purchase that coverage. But if you do not have a need to purchase items, procedures, or treatments that are common for a demographic in which you fit, then you do not need to pay for these procedures. And so if the goal is to ensure that we don't worry so much about coverage, but that we worry about care, that is, that you can actually get the medical treatment that you need, and the way to ensure more access to care is to ensure that we drive premiums down, then removing the essential benefits plan allows us each to shop the plan that suits us best and will immediately help to work to drive down premiums. So I stand by that. The corollary to that would be community ratings. It's the same sort of concept.
Susan, do you have a response to that follow-up? We'll have a microphone for you in just a moment.
Thank you for your response. Appreciate it. But prior to the Affordable Care Act, there were health plans with skinnier types of benefits, and you strip away the essential health benefits, and people may be subject to being only able to afford very poor coverage health plans. And if you are a cancer survivor or have a pre-existing medical condition, you may not be able to get the kind of health plan that you need if you take away those essential health benefit requirements.
Thanks, Susan.
So I understand where you're saying, yes, sir. So I understand where you're coming from. What we want is to allow the market force so that people can choose what components of the plan they choose to have. And so if you don't need mental health treatment, but you're forced to take mental health treatment, then you know that your care and coverage, your coverage will cost more. And if it costs more and you can't pay your deductible, then you're not going to care.
All right, let me follow up. This is related to the health care issue, but it's a sort of an explicitly political question from Nancy Rodland of Green. Nancy, are you with us? Thank you. So, Congressman Garrett, because you recently voted a firm no on the American Health Care Act bill and a member of the House Freedom Caucus, are you concerned about President Trump or other Republican colleagues running a candidate against you in primaries in 2018?
You know, honestly, Pete, if you sit around and we worry about whether or not your run to re-election is going to be harder or easier, then you're not focused on what you're elected to do. And my father, God rest his soul, who died from cancer. My mother's beaten him 3 times. Told me when I was young that he felt like he looked people in the eyes and said, "This is what I believe in, this is what I'm going to do," and then you go and you try to do it. That they'll respect you, and that's a recipe for success. And so I think that's what we're trying to do. And you know what? I'm not married to a title. I'm Tom Garrett from, born and raised and graduated from Louisiana High School. And I'm just kidding. And so if I'm somewhere else in 2 years, and I'll have more free time, I guess. But I'm not concerned with it. We're going to be who we are. Some of you guys are going to think it's wonderful, some of you guys are going to hate it, and that's what makes America such an amazing place. Because we have forums like this, we can even yell and scream at each other, but we're not going to kill each other, and we're going to continue to fight for what we believe in, even when it's the opposite. So yeah, whatever. I mean, run somebody against me. I don't care. I want to do my job the best I can do it, so that when I stand before my Creator, I say, "I'll let you all feel it, everything I can do."
We appreciate your sincerity. Our next question, this will be our last one on healthcare, and we'll move to another topic. This is from Allison Miller of Jose. Allison, you with us? Thanks. 8 years ago, my uncle died due to a prescription drug overdose. I've had many friends and family struggle with substance abuse and mental health issues since then, but get the treatment they needed because of the essential health benefit and ACA subsidies. Every proposed new plan would undermine or eliminate this coverage. Will you promise to vote against any plan that will remove the requirement these services be covered or make them harder to afford?
No, in fact, I will not vote for a plan that leaves essential health benefits in it. And it's a fundamental requirement. It's none of this is scripted, it kind of comes out. But no, I really genuinely believe, look, God bless you, okay? I was a prosecutor for 10 years. We had a fentanyl death every single year, like clockwork, prescription med, in little tiny Louisa County. I watched the body of a beautiful young college student from the Virginia Commonwealth University get dragged on a snowbank because of the prescription meds that she overdosed on. But if you do not need to pay for mental health treatment, you shouldn't be forced to pay for mental health treatment. Because if everyone's thrown in the same wagon, it drives everyone's rates up. And the problem, again, as I see it, and you're welcome to disagree, and I respect it, is that we have a circumstance where we have pieces of paper that say we have insurance, but we don't have access to care because we can't pay our premiums and deductibles that skyrocketed over the last 7 years. So it's okay to disagree, but no, not only will I not only vote for it if it has it, I won't vote for it if it does.
Fair enough. We're going to shift gears here a little bit away from health care. We're going to move to our... Oh, I'm sorry. Excuse me. Ma'am, would you like to follow up?
Yes. Respectfully, I would just submit that there's a difference between care and coverage, but if you don't have coverage, that pretty much obliterates the chance of people getting care.
So, over half the new people who are covered under the Affordable Care Act aren't covered by the Affordable Care Act, they're covered by Medicaid. Which is...
Excuse us, we'd like to hear the Congressman respond. Thank you.
Which is essentially indigent care. It's people who can't pay for care, who are swept up into a safety net, which we should have in the United States, the most prosperous nation in the world. But it's indicative of the failure of the Affordable Care Act, where the individual mandate can so frequently be flouted that you have millions upon millions of people who remain uncovered because they've done something that's inherent to a free market, and that is exercise their free will. And ultimately, if you go into a hospital emergency room, you will read on the wall that the hospital emergency room may not refuse care to anyone based on any circumstance, to include even their citizenship status. And I support that too, because we don't need people in this most prosperous nation on the planet dying in the gutters. But when you try to create a paradigm that's been falsely pushed as providing something to people that it doesn't, that is health care, when in fact we have now almost 100 fewer providers than we did 7 years ago, that was sold to us on the promise that our premiums would drop by $2,500 a year, that it didn't. That if we liked our doctor, we could keep them, we couldn't. If we liked our plan, we could keep it, we couldn't. That the deductibles would drop, they didn't. Then it's time to look for some different way to deliver that good service. And so what we have is a circumstance where the Democrat governor of Minnesota says the Affordable Care Act isn't and it's destroying our state, and where Bill Clinton, former president, says this thing's the biggest joke, unquote. So what we're trying to do is listen to ideas from all sides of the aisle, which is why I was a champion of the McCarran-Ferguson appeal, first advanced by Democrat Tom Garrett, to find ways to drive the